Cellulitis is a bacterial infection of the skin. It starts with a break in the skin and spreads into the layers of connective tissue beneath the skin and even the lymph nodes if left untreated. Treatment usually consists of bandaging and a prescribed antibiotic regimen. Exercise may prevent cellulitis, and in some cases, may be part of treatment. If you have cellulitis, or suspect you do, check with your doctor about any treatments you are considering. When Mike turned 65, he was 25 pounds overweight. By strict dieting, he shed the extra pounds, but he lost more weight. He also lost his energy and vitality. He was always exhausted, and his friends, seeing his gaunt, drawn face, worried about his health. By the time volunteered for a particular fitness program 2 years later, he had put 25 extra pounds back on. After 6 months of exercise and some willpower at the dinner table, Mike slimmed down again. This time he felt better than he ever had, brimming with energy and glowing with good health. What made the difference? The first time Mike lost weight, the second time he lost fat. The distinction is important. According to research, a large portion of the weight lost by dieting alone is active tissue, such as muscle and connective tissue, while a smaller fraction is excess fat. Exercise has the opposite effect. It increased his lean body mass and decreased his excess fat. Same thing goes with cellulite. Most people tend to think that cellulites are only present to people who are obese. That is why they sometimes associate cellulite with fats and obesity. Actually, even if cellulite refers to the chain of wrinkled fat cells and subcutaneous connective tissues beneath the layer of the skin, it should never be associated with people who are fat or obese. In fact, there are many people who have cellulite but are not fat at all. In reality, nobody knows the main reason why some people accumulate cellulite. However, there are some factors that health experts are considering, such as the structure of the fat cells or the poison that entered the body. Some experts say it may be caused by some hormonal changes in the body. But none of these things has been proven to cause cellulites. However, the only main reason why most of the cellulite cases are abundant in women is that the connective tissues of women are more rigid and firm than men. Hence, whenever a woman gets fat, the fatty cells tend to swell and get bigger. It creates a protruding appearance to the skin, producing an orange peeled look. For this reason, women are more prone to cellulite than men. That is why it is important for women to be more careful on their body, as they have higher chances of accumulating cellulite. Fats and cellulite. With the many cases of obese people having cellulites in their body, most of them believed that their cellulites are caused by being too fat. Even though not all those who are obese develop cellulites, being overweight can really trigger the development of cellulites. This is because too much fat under the skin tend to push the connective tissue, creating a strain on the skin. Thus, cellulites form. However, this is still dependent on the structure of the cells. If an individual's cell structure does not inhibit the tendency to bulge or expand even if fat deposits accumulate, then there will be no cellulites. So, the most important thing to remember here is to keep those connective tissues firm and strong and avoid accumulating excess fat so as to avoid the development of cellulite. How? Start an exercise routine program. Transforming food into fat seems all too easy for most of us. Losing fat is far more difficult, and to accomplish this, we have only 3 alternatives. 1. Decrease food intake and keep activity constant. 2. Increase activity and keep food intake constant. Or 3. Combine both approaches, diet and exercise. Physical activity can help reverse the results of inactivity. An hour of vigorous exercise burns up 300 to 600 calories. If you also cut 300 to 500 calories from your daily menu, you can also lose weight at the rate of 1 to 2 pounds a week. Without exercise, you would have to eat 500 to 1,000 fewer calories a day to lose the same number of pounds in a week. Exercise is not for everyone who is over fat, however. The severely obese person should exercise only under medical supervision to prevent strain on the cardiovascular system and connective tissue. And no one should restrict food intake drastically without consulting doctor. Resorting to this kind of activity will only get the matter worse. Remember what happened to Mike? He thought that when he started dieting, he would eventually lose all the excess fats he has accumulated. The problem is that he lost those connective tissues rather than excess fat. For people who are prone to cellulitis, this will be a greater problem. Losing connective tissues instead of fat by strict dieting can only make the skin more prone to greater problems, but the fat cells are still there. That only means that the problem is not solved at all. Hence, if you wish to lose those cellulites, it would be better to lose those fats first. The idea here is to burn those fats by increasing your metabolism by 7.5% to 28% more than your normal rate. It is for this reason that exercising is an important factor in losing cellulite. So for a more cellulite-free body, always engage in an exercise routine. Preventing cellulitis. According to Cellulitis by Dr. Amy Stanway, obese and diabetic individuals are at high risk for this type of infection. Exercise, particularly cardiovascular exercise, helps increase circulation throughout the body and reduces weight and other diabetic risk factors, hence lowering your risk of developing cellulitis. To exercise for optimum health benefits, the American College of Sports Medicine recommends you engage in at least 30 to 60 minutes of moderate intensity exercise 5 days per week, or 20 to 60 minutes of vigorous intensity exercise 3 days per week. Recognizing the symptoms. Cellulitis is most often seen in the legs and is identified by redness, swelling and tenderness. The area may also be painful and warm to the touch and may be accompanied by a fever. In some cases, blisters may form in and around the affected area. Cellulitis can develop in as little as 24 hours and can expand rapidly if left untreated. Call your doctor or visit the emergency room immediately if you suspect you have cellulitis. Treating the infection. Treatment for cellulitis typically includes an oral antibiotic prescribed by your doctor and a bandaging and cleaning routine. Elevation may be used to reduce swelling and ease pain. According to the National Institutes of Health, you should rest until your symptoms improve. With this recommendation in mind, wait until you have your doctor's clearance before you resume any physical activity. Exercising after cellulitis. Once you have finished your antibiotic regimen and have been cleared by your doctor to resume physical activity, take proper care of your wound to ensure the infection doesn't rebound. If at any time your symptoms return, see your doctor before continuing your exercise routine. Be sure to rehydrate following your workout, as dehydration may contribute to recurrent cellulitis. If you are participating in activities with a high risk for cuts, like hiking, wear long pants and sleeves to protect your skin. What you can do. If you're side-eyeing the dimples on your thighs and butt, know that you aren't alone. Some data suggests that anywhere from 80 to 90% trusted source of adult women have cellulite somewhere on their bodies. Cellulite isn't size-specific. In fact, some people may actually be genetically predisposed to the condition. Although it's impossible to get rid of cellulite completely, there are things you can do to minimize its appearance. Strength training, especially when combined with diet and cardio, can reduce body fat and sculpt muscles, helping erase some of those dimples. Ready to get started? All you need is 20 minutes to try this lower body routine. 1. Step up with reverse lunge. You'll need a bench or other elevated surface for this combo move. It works your quads, glutes, and hamstrings, giving you more bang for your buck. 2. Curtsy lunge. The key to a round booty is to work all sides of the glute muscle. The curtsy lunge hits the gluteus medius, which is important for hip stabilization, in addition to engaging your quads and hamstrings. 3. Lateral lunge. The side lunge also targets the inner and outer thighs, making for a well-rounded lower body routine. 4. Split squat. You'll need a bench or some other elevated surface to complete a Bulgarian split squat. This move works your quads, hamstrings, and glutes. If you need a challenge, hold a lightweight to medium weight dumbbell in each hand to really feel the burn. 5. Glute bridge. Unlike other leg exercises, this glute targeting move doesn't put any pressure on your lower back. If the traditional glute bridge becomes too easy, switch to a one-legged variation. For an even bigger challenge, try a weighted hip thrust. 6. Squat jump. This high-impact move can be a bit jarring. It isn't for beginners or anyone who has concerns about their joints. 7. Stability ball hamstring curl. You'll need a stability ball to complete this exercise, so save it for a gym day. Don't let this body weight move fool you, it's deceivingly simple, but you'll feel it the next day. Do you want to know more about health and wellness? Would you like to know how to live a healthy and natural lifestyle? You have reached the right place, the Natural Healthy Lifestyle channel. We really would love you subscribe and activate the bell. It would be very appreciated. And remember, we love you. So we will help you to have a natural and healthy lifestyle. Take care of your health. And enjoy life.